Of all the costs associated with water and sanitation, capital maintenance is probably the most neglected. The costs of major repairs or replacements, often unexpected. In rural Africa or Asia, the failure of a pump or well may require communities to rebuild from scratch because there's no money for repairs. Vida Duti, IRC Country Coordinator in Ghana, explains how they're working with government agencies to ensure that a breakdown does not equate to a collapse of service.
Capital maintenance is the cost of replacing the facility or the cost of doing major maintenance of the facility. At the moment for Ghana, there's no clarity on responsibility for capital maintenance, and that affects the system, particularly when there are major repairs or requirements for rehabilitation. Unfortunately, the communities are not able to collect enough tariffs and therefore are not able to have enough resources to take care of major costs that arise when the systems break down. Presently, we don't know the costs of the capital maintenance. Some support has been provided in the past, but it's been on us and when required basis. What we are doing now is to have a reliable cost information to be able to do proper planning and forecasting of expenditure for these costs. We are working with the Community Water and Sanitation Agency. We have established a small technical committee at the national level that is working with the district assemblies to look at the main cost items for capital maintenance, as well as alternative means of providing the financing. The different ideas that came up was to look at the possibility of insuring the facilities, so that when there's a problem, the insurance firms can take up the costs. The other option that is being considered is mutualization of funds, where each community would provide resources into a mutual fund, and when there's a problem, they can count on that fund to repair their systems. Most communities are in favor of pooling the funds. Others are not in favor because they have had experience of trying it in the past and it hasn't worked very well. And so one of the steps that we are going to do is to look at why those systems didn't work in the past and what can be done differently. Speaking to the insurance firms, it's been established that not all the parts of the systems can be insured. And therefore, we are going to look at the feasibility in terms of those aspects that cannot be insured can be supported through the mutual fund scheme. We are going to look at the feasibility of these options that are being proposed, and then also consult with the communities on their preferences. We're thinking that this whole process would take about 6 months to finish. The next step would be to also have a national dialogue on sector financing, where these options would be proposed to stakeholders, to governments, development partners, and to the NGO community, so that we all as a country decide on an agreed scheme for providing reliable support to financing capital maintenance.